Low health literacy was a significant public health issue. It caused individuals to have poor self-care and quality of life, which consequently affect patient health outcomes. It was a significant issue that must be addressed because it affects both the patient and healthcare provider. Despite the number of studies on the topic, it was recognized that there was a lack of published data on health literacy in Southeast Asian nations, particularly the Philippines, which justify further research and investigation. Good day. We are the BEs and 3G, Group 2A. We will present to you our research entitled Level of Health Literacy Amongst Nursing Students. I am Emelia Demerin, and together with me, Nicole, Cocos, Frecelle del Castillo, Reena, Dorothy, Derequito, and Manzi Dico.
The study aimed to determine the level of health literacy knowledge and experience among 7 sections of fourth-year student nurses enrolled at the University of St. La Salle Bacolod during the 2022 to 2023 academic year.
Study sample. They were the Level 4 student nurses enrolled in the Bachelor of Science in Nursing at a local university in Bacolod City during the academic year of 2022 to 2023. There were a total of 271 in the population, with a sample size of 161 in the study. It was obtained through Sloven's formula with a 5% margin of error. Stratified random sampling was used to acquire the desired subsample sizes from each section and its corresponding sample sizes by gender.
To discuss the methods of our research, a descriptive correlational research design was utilized wherein the correlation between variables in the study was examined. To specifically correlate the significant relationship of student nurses to their health literacy knowledge and experience based on their various sex, section, and general weighted average. In collecting the data, the survey method was employed in asking targeted questions on participants in order to garner information about their behaviors and preferences.
This study utilized a standardized questionnaire adopted from the updated Health Literacy Knowledge and Experience Survey version 2 by Cormier. The 21-item research instrument consists of 3 sections: demographic data, health literacy knowledge, and health literacy experience. Part 1, collected demographic data of the participants, which consists of 3 variables including sex, section, and general weighted average on health education. Part 2, the health literacy knowledge section consists of multiple choice items that assess the cognitive level of the participants. Part 3, obtain information regarding the health literacy experience of the participants during their clinical and community exposure.
Results and discussion. The demographic profile of student nurses was determined using the frequency distribution and percentage in accordance with sex, section, and the general weighted average on health education. The participants were dominated by female student nurses at 73.3%. In terms of section, the most numbered participants were 14.9% from Section C. And when grouped according to the GWA on health education, more than half, or 57.8% of participants had an outstanding final grade 90 to 100.
The level of health literacy among student nurses in terms of knowledge. The results showed that the majority of the student nurses had an adequate level of health literacy. It revealed a weighted mean of 6.09 with a standard deviation of 1.962 interpreted as adequate. The level of health literacy among student nurses in terms of experience. The results showed that the majority of the student nurses had an sufficient level of health literacy. It revealed a weighted mean of 3.3649 with a standard deviation of 0.62998, which was interpreted as sufficient.
For the difference in the level of health literacy knowledge among student nurses when they are grouped according to sex, section, and general weighted average on health education, there was no significant difference. Therefore, the null hypothesis was not rejected at 5% level of significance.
Relationship between the level of health literacy in terms of knowledge and experience. The results showed that there was no significant relationship between the knowledge and experience and health literacy of participants. Therefore, the null hypothesis was not rejected at 5% level of significance. This implies that both of these variables didn't affect one another and were both independent individually on the student nurses.
For a relationship between the level of health literacy knowledge in terms of profile variables, the results present that there is no significant relationship between the health literacy in terms of knowledge and profile variables. Therefore, the null hypothesis is not rejected at 5% level of significance. Then, for the relationship between the level of health literacy experience in terms of profile variables, The results illustrate that there is no significant relationship between the health literacy in terms of experience and profile variables. Therefore, the null hypothesis is not rejected at 5% level of significance. In conclusion, the study determined that the 161 level 4 student nurses, majority of the participants had adequate health literacy knowledge and sufficient health literacy experience. The level of health literacy knowledge among nursing students based on their sex, section, and general weighted average in health education are statistically the same, while the level of health literacy experience among nursing students is also statistically the same, except when grouped according to sex, where there was a significant difference due to sample size and population. Moreover, there was no significant relationship in the level of health literacy in terms of knowledge, experience, and profile variables among the level 4 nursing students.
For the recommendations, nursing schools and administrators should offer experiential learning opportunities, such as more clinical experiences, simulations, and volunteer programs offered within the school to reinforce their pre-existing knowledge and skills. Clinical instructors should integrate health literacy discussions into a clinical practice and instruct them on how to apply health literacy. Student nurses should take initiative to advance their knowledge of health literacy outside of the classroom by participating in organizations, programs, or advocacy such as Grand Medical Mission, Red Cross Youth, and more. Future researchers should conduct studies taking into account variables that affect health literacy like gender, cultural influences, and the effectiveness of educational intervention in order to broaden their understanding of health literacy among nursing students.
And that concludes our study. Thank you.